Chad Robbins here with The Skinny, and we're answering a great question today. Why do people remove breast implants, and what happens afterward? So that is a great question. We could talk a long time about that, but we'll try to keep it succinct. There are several reasons to remove breast implants. First of all, they're old. Second of all, they're compromised in some way, which is a nice way of saying ruptured or encapsulated or have problems. The third reason is you just want them out. And the third reason includes something called breast implant illness, which is a phenomenon described by people who feel like their implants make them sick. And that's also a good reason to take them out. But you just want them out, sure, take them out. If they have not been in a very long time, a lot of times you can take the breast implants out and the breast tissue and the skin is still elastic enough that you won't leave the patient with any sagginess, saggy skin and saggy breast. A lot of times when these breast implants have been in for a longer time, a year or more, removing the breast implant will almost be like, we call it deflating the pillow. Like you take the stuffing out of a pillow. So that breast skin and that breast tissue sags more after you remove the breast implant. So a lot of times people will do a couple of things. Sometimes they'll replace it with another breast implant. If the implant that you're removing is old or ruptured or encapsulated, that's when there's abnormal scar tissue around it. We remove it and then we replace it with another implant. A lot of times that's a great way to maintain shape and volume, especially if the people are happy with their shape and appearance of the breast in those scenarios. But for people who are going to be droopy and have droopiness, either because they're switching to a smaller implant or they're just getting rid of the implant altogether, most of those people need a lift. And there are several types of lifts, several different techniques. We'd have to see you during consultation to make a specific recommendation, and we're happy to do that. But just make sure you see a board-certified plastic surgeon if you're thinking about having your implants to remove, to kind of see whether you're going to have any droopiness after it and what your options are.